my name is Jocelyn Inverdon. I'm a PN student at Williston State College, and today I'm going to be doing a postpartum assessment skill check. So first I'm beginning outside of my classroom and I'm about to enter. So, knock, knock, knock. Good morning, Shirley, how are you? Good, my name is Jocelyn. Today I'm going to be your nurse. I'm just going to go ahead and check your wristband. It's actually going to be on that side, but making note of any allergies and confirming who my patient is. So, how's everything going? How are you feeling? Good, your vitals look really good. I'm just going to do a little bit of an assessment on you here. Do you mind if your family goes ahead and takes a step out? Okay, perfect. I'm going to perform hand hygiene, make sure my door is closed, and provide privacy with a curtain. So I'm going to go ahead and just start with your eyes. Are you seeing any rings around the lights or any blurred vision? No. Okay, that's good. Sometimes people have some vision changes after birth, so I just wanted to make sure that no changes have been made. Are you feeling any pain? A little bit of pain. Can you rate that on a scale of 1 to 10 for me? It's about a 5. Okay, can you describe what kind of pain it is? It's a cramping pain. Okay, what makes it worse or better? It feels better when you're in a warm bath. Okay, and you experience it more when you're breastfeeding. Okay, that's fairly normal. I'm gonna go ahead and your chart did say that you had pain meds about 4 hours ago, so once we're done with this, I'll go ahead and check and see if we can get you another pain med. So I'm going to go ahead and assess your breast. They said during report that you're breastfeeding. How do you feel like that's going? You feel okay? Okay, it's still a little painful. I can understand that. So first things first, I'm going to suggest that we get a nice supportive bra on. It's really important to get some support in the first couple of days of breastfeeding. So I'm going to just go ahead and assess here. Everything looks good around. It looks like you have a little bit of cracking and blistering on this one. Same for that. So first thing we're going to do is I'm going to get you some lanolin. Lanolin is just going to go ahead and soothe those breasts the first couple of days, since breastfeeding can be so painful. And when using lanolin, you're going to put a pea size on your finger and you're going to rub it in between your fingers and get it nice and warm. And just go ahead and rub it on your nipples, and it is safe for babies, so you don't have to wash it off before you breastfeed. Okay, and then next I'm going to go ahead and have you put your call light on when you're about to feed baby. I want to come in and assess latch and make sure everything is going well for that. Okay, so next I'm going to go ahead and lay you down here. I did see that you had a C-section. How are you feeling after that? You're feeling okay? How's eating been going? Going good. Okay. Have you passed gas? Yes, you have. Wonderful. What about a BM? No BM. Okay, that's pretty typical. I wouldn't expect you to have one this early. I did see that your catheter is out. Have you voided? Okay. Any pain? Anything significant with voiding? No, everything feels good. Okay, so I'm going to go ahead and look at your incision site here. Just going to take a look at it. Okay, so everything looks good. There's no redness, edema, bruising, drainage. Your wound edges are approximated. Everything looks good. One thing I'm going to suggest: when you head home, I want you to make sure you're washing that when you shower every day, keeping it dry and clean. And I want you to make sure and assess it for any signs of infection, which would be that pain, that warmth, that drainage. And if you do, I want you to go ahead and call your doctor. Okay, so next we're gonna go ahead and I'm gonna massage your fundus. So I'm gonna pull your underwear down, and it looks like your pad here, you have some lochia on that. When was the last time you changed this? It's been about 6 hours. Okay, so I'm gonna note a little moderate lochia on here, and we're gonna get a clean pad for you as soon as we're done here. So to start, I'm going to roll your gown up and I'm going to massage. So starting at your umbilicus, I'm gonna go ahead and you're gonna feel some light pressure. Okay, and I'm also gonna support right above the pubic symphysis. So I'm massaging, I'm feeling your uterus, it's firming up, that's good. I'm also gonna note that your uterus is one under the umbilicus, which is also good. I see that I'm expressing some small clots, which is normal. I'm going to go ahead and I'm going to get you a clean pad throw this away, get you a nice clean pad under there. Perfect. Under that. I'm going to change my gloves, and now we have a vaginal birth. So first I'm going to go ahead and educate you. When you head home, I want you to note if you've had more than 2 pads in 2 hours, or if you're expressing clots the size of an egg. That is something you need to contact your doctor about. So I have clean gloves on. I'm going to go ahead and lift my client's bed, lay her completely flat, and I'm going to do an assessment for a vaginal birth. Okay, Shirley, I'm going to have you roll over onto your right side on 3. 1, 2, and 3. So first thing I'm going to do is make sure she's minimally exposed. I'm going to separate her buttocks. I'm going to assess and see if there is any trickling, a constant trickle of blood, any edema, and it looks like there is some, so we're going to go ahead and get you an ice pack for that, Shirley. And if she were to have episiotomy, I would go ahead and assess that as well. I'm making note that my client does have some hemorrhoids. Shirley, are those hemorrhoids new? No, you've had them. Okay, are you experiencing any new pain with those? No, you're pretty, they feel the same? Okay, so your doctor did order you a stool softener. So we're gonna go ahead and increase the fiber in your diet, make sure you're getting plenty of fluids, and that's gonna help that wound healing. It's gonna help the healing process down there, and that softener is gonna make that first BM a little more comfortable with those hemorrhoids. Okay, so I'm gonna go ahead and get some clean, fresh gloves on, and we're gonna move down to my client's legs. So how are your legs feeling, Shirley? Yeah, they feel a little swollen. They look a little swollen. Nothing, no pain though? Good, no pain. So I'm gonna assess my client's legs for edema, and it looks like there's 2+ pitting edema on her shins, 1+ on her ankles. If tops of feet look good, I'm gonna assess her pedal pulses. They are strong and equal bilaterally. That is good. Go ahead and cover her up. Okay, Shirley, so your chart, put these in my trash can. So your chart, your blood work came back, and it looks like your blood is A positive and baby is B positive, which means you don't need that RhoGAM injection or any additional injections either. So how do you feel? How is the transition to motherhood going? It's going good? You're just ready to head home. I can understand that, yes. I do want to let you know that some moderate sadness or the baby blues in that postpartum period is typically normal. I do want you to, if they do seem to progress or not getting any better within that first 7 to 10 days, it's normal. After that, if they progress, I want you to go ahead and consult your doctor. If you do have thoughts of harming yourself or the baby, I want you to call 911. Next, I'm going to go ahead and check on that. This bed is moving. I'm going to go ahead and check on that pain medication for you, and I'll look at that, bring that laxative back as well. Do you need anything before I leave? Okay, here's your call light before I head out. Let me know if you need anything, and I will be right back.